Good night, guys. Hope all is well. I'm just here today to talk to you about differential diagnosis for inguinal swellings. So, one of the things that comes in the Mrcs examination with regards to inguinal swellings, hernias. Hernias is the bread and butter of surgery. So, if you don't know how to manage a hernia, as I mentioned before, you're solved, which means you're in problems. So we all know how to examine hernia. Start with the patient standing to see if the mass extends into the scrotum, if it's inguinal scrotal versus just confined to the inguinal canal. We know all of that. We know how to try to reduce the hernia to see if it comes through the superficial ring alone or the deep ring going in through the superficial ring, spreading down into the inguinal region. However, one thing that I seem to pick up from medical students is that when you ask them for differential diagnosis of inguinal swellings, they tend to have difficulties. And the reason for that is that they're so fixed on the fact that it's just a hernia that they'd forget the other possibilities. For one, a hernia might not necessarily be an inguinal hernia. It could be an inguinal femoral. There's an obturator. There's so many hernias that can occur down in the inguinal region. For instance, if it's a 76-year-old female who comes in, you have to rule out femoral hernia because femoral hernias can strangulate very, very easily and require surgery as soon as possible because you do not want any form of strangulation of bowel to occur requiring a laparotomy, an emergency laparotomy. You're trying to reduce the chances of an emergency laparotomy being performed. So from that point of view, you have to be able to identify. So above and medial to the pubic tubercle, you're thinking inguinal hernia. Below and lateral, you're thinking femoral hernia. Age lets you kind of pick up on whether or not it's a femoral hernia. Although femoral hernias mostly occur in females, they can occur in males, but majority of the times it's a female. So differential diagnoses of inguinal swelling. What do you find in the inguinal region? There's a femoral vein, femoral artery, there's lymph nodes. So when you go into the examination, they ask you, okay, so what is it? You'll say, well, it's an indirect hernia, or it's a direct hernia, or it's a femoral swelling. And then say, can it be anything else? That's when you should just get a burst of energy and say right away, well, it can be a lymph node enlargement, lymphadenopathy. It can also be a saphenous. It can be an aneurysm of the femoral artery. You can also go rolling straight into things like abscess, lipoma. And these are things that you need to just rattle off. Once you start to rattle off the differential diagnosis, the examiner will stop you and say this person knows exactly what they're talking about. And then they move on to other things like management of the hernia. So always keep at least 4 or 5 differential diagnoses in mind. So you have hernias, things that like masses that you find in the abdomen. So one thing that I don't think they'll bring for the exam in terms of a patient, because they're afraid that it might the constant palpation of the abdomen might result in the rupture of it, is an abdominal aortic aneurysm. But if they bring a case, for instance, they say to you a patient comes with a pulsatile expansor abdominal mass, your differential diagnosis, they probably ask you to zone in directly on that diagnosis, which being abdominal aortic aneurysm has to be ruled out. They ask you things like, how do you screen for it? And then you will say, well, a CT scan can be used to monitor if there's any leakage or expansion of the mass. I think the measurement is 5 to 5.5.